The distinction between psychologists and psychiatrists can be confusing for many people. While both professions focus on treating mental health conditions, there are essential differences between the two that are important to understand. In this video, we will examine the differences between psychologists and psychiatrists, including their training, specialties, and approaches to treatment. The most significant difference between psychologists and psychiatrists is their training and background. Psychologists hold a PhD or Doctor of Psychology degree in psychology, and typically have specialized training in studying human behavior and mental processes. They are trained to use psychotherapy or talk therapy to help individuals with mental health conditions. In contrast, psychiatrists are medical doctors who have completed a 4-year residency in psychiatry and are trained to diagnose and treat mental health conditions using psychotherapy and medication. Another difference between the two professions is their approach to treatment. Psychologists generally focus on talk therapy, which involves helping individuals understand and work through their thoughts and feelings. This therapy is often used to treat various mental health conditions, including depression, anxiety, and PTSD. On the other hand, psychiatrists are trained to diagnose and treat mental health conditions using psychotherapy and medication. They can prescribe and manage psychotropic drugs, which can help alleviate symptoms and improve mental health. Specialty areas are also distinguishing factors between psychologists and psychiatrists. Psychologists often specialize in areas such as clinical psychology, counseling psychology, or developmental psychology. On the other hand, psychiatrists may specialize in areas such as child and adolescent psychiatry, addiction psychiatry, or geriatric psychiatry. This specialization allows them to provide more targeted and effective treatment for specific populations. Another difference between psychologists and psychiatrists is their availability. In some areas, it may be easier to access a psychologist than a psychiatrist, as there may be a shortage of psychiatrists in specific communities. In addition, many insurance plans may cover psychotherapy with a psychologist but not with a psychiatrist. It is important to check with your insurance provider to determine the coverage for each type of mental health professional. In conclusion, while psychologists and psychiatrists share a common goal of helping individuals with mental health conditions, there are important differences between the two professions. Psychologists hold a PhD or Doctor of Psychology degree in psychology and specialize in talk therapy, while psychiatrists are medical doctors trained to diagnose and treat mental health conditions using psychotherapy and medication. It is essential to consider the differences between the two professions when seeking treatment for a mental health condition. See you in the next video.